Good evening. You're talking to Dr. Dan Eli Anigo, a consultant of Sky. At the end of this discussion, I would expect, especially my first-time mothers, the primaries, to be able to know the main reasons why cesarean sections are performed. There are many indications why we do cesarean section. The maternal indications include a maternal illness in pregnancy, such as preeclampsia. You realize that conditions like preeclampsia, which is a pressure which usually develops during pregnancy, are more common in first-time mothers compared to the rest of the mothers. So if for some reasons the mothers had a very severe preeclampsia, where the pressures are above 160 over above 110, and she has evidence of either kidney or liver injury, such pregnancy needs to be delivered as soon as possible, actually regardless of the gestation age. Because if you do not do cesarean section for such a mother who has had severe preeclampsia or high blood pressure, there are higher chances that the condition will damage the mother's kidneys and liver, and eventually it can be very dangerous to the mother. There are also other situations when, for example, the mother has had other medical illnesses. For example, if a mother has HIV and has not been on treatment, or the viral loads are so high, we would encourage that for us to be able to reduce infection to the baby, the mother should be delivered by cesarean section, because there the encounter of the fetal blood and maternal blood will be minimized during delivery. Other maternal illness like herpes simplex, type 2. So there are times when some mothers develop lesions down around the vulval area, the vaginal area, and if the infection is current, you would prefer that such mother should deliver by cesarean section to prevent the baby from eventually getting a viral herpes simplex, which can lead to viral encephalitis in the newborn baby. This also includes things like mothers with extensive genital warts, which may be able to obstruct down the progress of any labor. There are also other certain maternal conditions, such as uterine fibroids. If uterine fibroids are very common in so many women, but in some situations, if a fibroid is located down towards the cervix, it can be able to obstruct the progress of labor. And so in that case, we would also encourage that such mother should be delivered at times by cesarean section. But you need to know that not every mother who has a uterine fibroid should be operated. It's only when that the fibroids are located in a manner that they can obstruct their fibroids, which are inside the uterine endometrium, which we call submucosal, and those which are cervical fibroids. In such situations, yes, you can be able to consider that such mother should be delivered by cesarean section. Of course, there are also certain maternal conditions that may probably you would want to manage concurrently. It can be other surgical conditions which you would want to manage concurrently. Upon delivery, you want to do surgery for the mother. Maybe if the mother is having another mesenteric cyst or another problem, in a situation like that, you can consider doing a cesarean section, and then using the same incision, removal of the cyst or another surgical condition can be considered. Also, in some rare situations, there are mothers who can be having some other forms of cardiopulmonary disorders. Although generally speaking, somebody is having a heart problem which does not affect in any way delivery process, it is better off actually a mother delivering vaginally than through cesarean section. So those are some of the common maternal problems that can lead to us determining that the mother should be operated. I've not covered all, but those are the common conditions which can lead to maternal indication of a cesarean section. Of course, some other reasons, if a mother is young, young mothers also, you find at times their pelvis is so small. In a situation like that, it is not possible for them to be able to deliver, which we call at cephalopelvic disproportion, meaning that the baby's head may not be able to pass. And also there are mothers who are not necessarily young, but if you examine them, you probably find that they either have a narrow pelvis, and in a situation like that, you would have loved to avoid having a very bad outcome. You would advise the mother to be operated. Some mothers, of course, have had history of pelvic injury, or they've had recently maybe an orthopedic surgery within the pelvic bone. In that case, also at times to avoid a further injury to the patient, because labor itself can be a very strenuous condition, you would love to do a cesarean section. So there are also other maternal indications for the cesarean section, rather not maternal but fetal indications. This could include things like fetal anomalies. There are situations when, for example, you find the baby has had an abnormalities like hydrocephalus. Hydrocephalus is a condition where maybe water accumulates in the baby's head, and the head is a bit too big for you to see that the baby can be able to pass. And then there's also a situation where the baby is quite big. We call it a macrosomia. This happens commonly, especially in mothers who are having diabetes, or mothers who have gained a lot of weight during pregnancy. At times the babies can be extremely so big, more than 4.5 kilograms. In a situation like that, you would want to advise such a mother to be able to consider cesarean section, because you do not want a situation where the baby gets injured. And then fetal malpresentations can be of any cause, it can be of any type. It can be maybe there's a transverse lie, or there's a breech. Especially for first-time mothers, it becomes extremely very important, and because we know breech delivery pregnancy is generally an abnormal presentation, and to avoid the injury of the baby, because when you have a breech pregnancy delivery, you are at a risk of having injuries such as brachial flexus injuries, and having things like intracerebral hemorrhages, or breaking of the legs of the baby, or injury to the pelvic of the baby, especially for delivery team, midwives who may not be trained sufficiently well to be able to conduct breech deliveries. So in situations where there is a fetal malpresentation, transverse or breech, we also encourage that there should be a cesarean section conducted. And then of course there are situations where also some babies, for example, can be having certain other congenital problems especially there. I will see in the situations where if a mother comes and the baby probably, or they are having a congenital anomaly. So there are also other fetal problems. For example, a mother might be progressing normally in labor, and then maybe when the water breaks, you find all of a sudden it is a cord which is presenting. Usually we call it a cord prolapse. When there's a cord prolapse, it can be a very dangerous condition, especially if the mother is not yet fully delivered or is just about to push, because in the process, at times the baby's head can be able to compress the cord, and in the process the baby will have a severe hypoxia. And so when there is a cord, a presentation of prolapse, we at times advise the mothers that we should be able to deliver them via cesarean section. Actually, the C-section I did last evening, it was a mother who had delivered 2 times before, but for some reasons, when she was about 8 centimeters, her waters broke, and she had a cord prolapse. And there in a situation like that, you need to really hurry to take the mother to theater, because if you do not hurry, at times you can find the baby is at a risk of dying. And then also, generally speaking, at times when you're monitoring labor, there are situations when you find that the baby all of a sudden starts having abnormal fetal presentations. It can be the heartbeats initially may go so high, usually above 80, but also if a baby, for some reasons, you're monitoring a labor on what we call a CTG, a cardio tachograph, and you see that she's having abnormal fetal heart tracings, what usually people call as a non-reassuring fetal heart. If it's persistent, and then you also observe probably other features like the deceleration and the fetal accelerations are not sufficient, at times you may need to consider doing cesarean section for any mother with the CTG that is abnormal. So those are very common reasons why we usually do cesarean section. Some of the reasons why we do cesarean sections are related with the actual progress of labor. Regarding progress of labor, there are many things which can affect a normal progress of labor, which we call as labor dystocia. There are situations when all of a sudden, if a mother is above 6 centimeters, the cervix fails to dilate, what is referred to as a cervical dystocia. When you have that, it's not possible for the mother to be able to deliver. Also, in some situations, you have what is generally referred to as a prolonged labor. In prolonged labor, the mother may have sufficient contractions, and for some reasons, there is no much progress. The dilatation, if it's a first-time mother, it will be less than 1.2 in 1 hour, and yet the contractions are sufficient. And then you see that the cervix is not dilating. Even then, the presenting part may be high. At times, some of these problems are combined together, because you may find that either the baby is having a malpresentation, either looking up, what we call as a persistent occiput posterior, which at times the doctors or the midwives may miss, because if the baby's head is so high up, you may not be able to feel the fontanelles well. So that in itself can be a reason, or if for some reason there's some kind of deflection, the head is not well flexed, it can also cause a poor progress. And then there can be an obvious obstructed labor. Obstructed labor, usually in a situation like this, the contractions are strong, but the baby is either too big to pass through the pelvis, and then you start seeing features of obstruction, such as seeing the edema in the head of the baby. At time the baby starts going into distress. In a situation like that, we can also consider doing a cesarean section. Of course, some of the reasons for cesarean section are more common in people who have delivered before, those who had a previous scar, I said that if you have previous scar, you can actually have trial of labor. But at times when we're doing cesarean section, you're supposed to have a lower segment incision on the lower aspect of the uterus. For some reasons, either if it is like you're having a preterm baby, at times some doctors make a vertical incision, which we call a classical incision. Usually when you've had a classical incision on a uterus, there is a high risk that this uterus can rupture during a trial of labor. So any mother with history of a classical uterine incision would have loved to do a cesarean section to avoid problems such as uterine rupture. And then the situations when maybe if the mother's had done myomectomy. If a mother's had a myomectomy, we also know that if the fibroids were removed on either the fundal or posterior aspect of the uterus, such aspects of those parts of the uterus because of the removal of the fibroids, they become weaker, and when they're weaker, because contraction usually starts up from the fundus of the uterus to the body, going down to the isthmus of the uterus. In a situation like that, you can risk losing the mother because of the intensity of contraction. So any mother who has been done a procedure like uterine fibroid would also like to consider them for things like cesarean section. Of course, one other important consideration usually is maternal indication of cesarean indication. At times, there can be the mothers themselves can decide that they want to deliver through cesarean section. That is also something which we can acknowledge. We cannot deny them, but they need to know the advantages and disadvantages of having a cesarean delivery, because if they don't get to understand that, because some people think a cesarean section is a shortcut to labor pains, which is not necessarily the case. So in reality, there should be a strong obstetric reason for somebody to be able to do to have a cesarean section. So my friends, if you are pregnant, in the next few months you're going to deliver, you may need to engage your doctor about the chances of what kind of a delivery you'll have. It's always good to have a clear delivery plan so that you are prepared. And if you, for some reasons, want to have another consultations with me privately regarding what delivery mode is appropriate for you, you can text me on my WhatsApp number as written below, or write me an email. I'll be able to get back to you at appropriate time. Thank you very much. I am Dr. Dan Elaniku. Please subscribe to my YouTube channel.